Drayton, Managing Director of Simply Serve. I'd like to take this opportunity to thank all of the staff within Simply Serve for all the excellent work they've done to support the Trust through the pandemic. Your efforts and everything that everyone's done is really appreciated, not only by Simply Serve but by the Trust and by our community. We wanted to produce this video to highlight some of the excellent work that's been carried out by some of our teams within Simply Serve. I hope you find it enjoyable and interesting. Thank you.
Hi, I'm Debs Walker. I'm the Deputy IT Operations Manager and IT Team Manager. Pandemic in March, we supplied about 100 plus additional laptops to enable non-clinical staff to work from home and also to support clinical staff working from home. We upgraded the device that sends out text to people so they can work from home. We installed additional terminal servers so that the portal would work for people using their own devices, and the staff have a rota now where the first line people are at home.
Hello, I'm Ben Trask. I'm Inventory Manager at Yeovil District Hospital. The materials management team are in charge of distributing various types of PPE to the Trust. On average, they supply around 20,000 surgical face masks a day, 20,000 aprons, 50,000 various sized gloves, 750 FFP3 masks and 250 reusable gowns. As a result of this, we've had to look into employing a PPE coordinator.
Hi, I'm Katie Matravers and I'm the Associate Director of Operational Procurement. The procurement, materials management and theatre stores lease teams have worked tirelessly behind the scenes to managing and sourcing PPE. Most importantly, at no point has a member of staff not had access to the relevant PPE.
Hi, my name is Summer. I work in the catering department of Yeovil District Hospital.
Hi, my name is Nathan. I am a catering assistant at YDH.
The catering team have been supporting our staff during this pandemic by making sure we can still supply them with meals as well as maintaining our patient food service. During the height of the pandemic, we delivered lots of meals for our staff to their wards and departments.
Between April and September, we have served 14,000 cups of buy one get one free hot drinks. We have served 15,500 free meals to staff during the pandemic and 3,200 hot drinks.
We have also supplied our staff with 14,600 free ice lollies and 1,234 litres of water.
Hi, this is the Equipment Library and I'm Andrea Drayton, the Team Manager of the department. In March and April we had tripled our expenditure in cleaning products because we had extra cleaning products and procedures in place. In the last 7 months we have spent about 4.5k on deep cleaning mattresses that have had suspected COVID patients on. We've also bought special equipment as in bags to have them covered in, so that transporting them back down to me to send off for a deep clean, they've all been contained.
Hello, my name's Martin Ford and I work for Simply Serve within Yeovil Hospital as the waste manager. In facilities, we've been involved heavily with moving departments and areas around to make sure that they've been COVID secure. We had to remove lots of furniture in waiting rooms and offices to ensure that areas were COVID safe for patients and staff. Most of these items were removed to off-site storage. In the height of the pandemic, we were required to provide urgent storage and shelving units for places like ICU and CBU to ensure that they had adequate space to store their PPE. Due to the increased demand for the disposal of PPE, particularly masks and aprons, we had to provide an additional 50 bins to various locations. Throughout the pandemic, it's been a real pleasure to work with the facilities and estates team. Everybody's pulled together and worked so hard to make things happen to keep people safe.
Hello, I'm Nicola Webber. I'm part of the Health and Safety team for SSL, and I'm the Safer People Handling, Ergonomics and Falls Awareness Trainer. In response to government and trust guidelines, we carried out over 30 risk assessments for offices and areas of work within the trust. But we had to assess them for how many people were going to be in the room so that we could ensure the appropriate social distancing, and to ensure that things like wipes and hand gel and various other methods were taken in place and rotas performed so that we ensured things were cleaned regularly and everyone was kept safe. In clinical areas where people were using fabric chairs, we changed all of these for vinyl, and that was critically important to enable hygiene and wiping them down. The rotas that we set up for cleaning things, with the Clinell wipes and the various other things, were very important and included door handles and light switches.
Hi, I'm Dave Whittlesey, Medical Electronics Manager. During the first phase of the pandemic, medical electronics increased their service performance level, increasing to a 7-day support. Between March and September, we commissioned over 1,000 new devices for the Trust and community. This was 30% higher than the same period in 2019. This included the procurement and commissioning of over 500 new medical devices with additional medical gas supply equipment. During the pandemic, our work requests increased by 20% compared with the same period in 2019, working on over 3,500 devices. A great strength has been the cross-collaboration with clinical teams and other SSL departments.
My name is Guy Campbell. I'm a porter at YDH. Between March and August this year, the porters completed over 57,000 jobs. Generally, with the COVID crisis, the porters have done a lot of ward and patient moves. There's a lot of juggling of stuff around, but we managed it okay.